Hello friends, myself Nandini Popat, studying in third year Pharm Maliba Pharmacy College, Bardoli. Today we are going to learn about Clopidogrel drug. So let's start. Let's have a look in content of this drug. Introduction, history of drug, classification, therapeutic use, pharmacokinetic property, pharmacodynamics property, mechanism of action, side effect, drug interaction, contraindication, drug dose, patient counseling, and lastly some quiz. So let's start. Clopidogrel is mainly an antiplatelet medication. It works by preventing platelet from collecting and forming clots that may cause a heart attack or a stroke. Classification of antiplatelet drugs. Antiplatelet drugs mainly divided in four types. First, COX inhibitor, second one P2 Y12 receptor blocker, third one GP2B3A inhibitor, and fourth one phosphodiesterase inhibitor. In COX inhibitor, example is aspirin. In P2 Y12 receptor blocker, divided in two types, irreversible and reversible. In irreversible, example is ticlopidine, clopidogrel, and pragrosin. And in reversible, ticagrelor and canagliol counts. In GP2B3A inhibitors, monoclonal antibody and synthetic molecules. In monoclonal antibody, example is abiximab, and in synthetic molecules, aptifibadine and tirofiban comes. In phosphodiesterase inhibitor, example is dipyridamole and leostazole. So history. It's first reported in 1987 to be an inhibitor of ADP induced platelet activation. It was first approved by the US FDA, Food and Drug Administration, in 1997. It is marketed by Bristol Myers Squibb and Symphony Aventis under the trade name Escover and Pelvix respectively. Source of drug. It has a role as antiplatelet aggregation inhibitor and anticoagulant and P2Y12 receptor antagonist. It is a thienopyridine, a membrane of monochlorobenzenes and methyl esters. It derives from ticlopid. So basically, what is Clopidogrel? Clopidogrel is a potent oral antiplatelet agent often used in the treatment of coronary artery disease, peripheral vascular disease, and cerebrovascular disease. It is a prodrug. It inhibits adenosine diphosphate ADP-mediated platelet aggregation by irreversibly blocking purinergic P2Y12 receptor on the platelet. It produces synergistic effect when combined with aspirin or GP2B/GP3A antagonist. It is newer and more potent co-churner of ticlopidine, has a similar mechanism of action, ability to irreversibly inhibit platelet function. Structural formula of Clopidogrel is C16H16Cl NO2S. Molecular mass is 321.82 gram per mole. Therapeutic use. It reduces the risk of stroke and heart attack in a patient who have already had a heart attack or stroke or other problems due to narrowing and hardening of arteries. When Clopidogrel used with aspirin to treat a new or worsening chest pain, like a new heart attack, unstable angina, and to keep blood vessels open and prevent blood clots after a certain procedures. Pharmacodynamic property. It's come under a brand name Pelvix. Route of administration is orally. Onset of action 2 hours. Dosage is 75 to 100 mg per day. Drug class antiplatelet agent and half-life is 6 hours for 75 mg doses. Half-life of active metabolite is 30 minutes. Pharmacokinetic properties. Absorption. Rapidly absorb after oral administration. Distribution. Distribute throughout the body with a peak plasma level 3 mg per dl. Metabolism. Highly metabolized in liver and rapidly hydrolyzed into it. Carboxylic acid derivatives. Excretion. Mainly through urine. Let's see mechanism of action. It inhibits binding of ADP to its platelet P2 Y12 receptor and subsequent ADP-mediated activation of GP2B3A complex. It proposed that the inhibition involves a defect in mobilization from the storage site of platelet granules to outer membrane. Drugs specifically and irreversibly inhibit P2Y12 subtype of ADP receptor, which is important in aggregation of platelet and cross-linking by the protein fibrin. No direct interference occurs with the GP2B3A receptor. As the glycoprotein, GP2B3A complex is the major receptor for fibrinogen. Its impaired activation prevents fibrinogen binding to platelets and inhibit platelet aggregation. By blocking the amplification of platelet activation by released ATP, platelet aggregation induced by agonist other than ADP is also inhibited by the active metabolite of Clopidogrel. Adverse effect: chest pain, fatigue, hypertension, edema, headache, nausea, vomiting, and nosebleed. Side effect: common side effect is bleeding and itchy skin, bleeding in gut, GI tract, and etc. In serious side effects, blood clotting and thrombocytopenic purpura. Drug interaction. Ripaglinide with a Clopidogrel. Ripaglinide. It is basically a diabetic drug. It increases the level of ripaglinide, thus decrease the blood sugar level. When Clopidogrel used with a proton pump inhibitor, it makes the Clopidogrel less effective. When Clopidogrel used with NSAIDs, it increased the risk of bleeding in stomach and intestine. Example: ibuprofen. Warfarin with Clopidogrel. It increases the risk of bleeding. When aspirin is used with Clopidogrel. If you have acute coronary syndrome, you should take aspirin with Clopidogrel. You should not take this drug together if you had a recent stroke. This will increase your risk of bleeding. Contraindications: hypersensitivity to the drug, and active pathological bleeding like peptic ulcer and intracranial hemorrhage. What is hypersensitivity? Hypersensitivity is a condition in which the normally protective immune system has harmful effect on the body. An abnormal immunological response to an otherwise harmless environmental stimulants, food, pollen, and animal air. What is peptic ulcer? It is ulcers occur when the stomach acid damages the lining of the digestive tract. What is intracranial hemorrhage? It refers to any bleeding within the intracranial volume, including the brain parenchyma and surrounding meningeal spaces. Dosing. In recent MI, recent stroke, and peripheral arterial disease, 75 mg once a day with or without a food. Or in acute coronary syndrome, start with a 300 mg loading dose and then continue with 75 mg once a day. So let's have a look on the patient counseling. Taken with or without regard to mean, it may take longer than usual to stop bleeding and report unusual bleeding and bursting. Inform healthcare provider about the use of this drug before undergoing surgical or dental procedure and before a new drug is taken. So let's have some quiz. First of all, Clopidogrel is commonly known as options are heparin, aspirin, warfarin or Pelvix. So right answer is Pelvix. Second one, Clopidogrel would be used to. Options are try to prevent heart attacks, prevent UTI, prevent sinusitis or combat dementia. So right answer is try to prevent heart attack. Third one, the following is true of Clopidogrel except options are it is a GP2B3A receptor antagonist, it inhibits fibrinogen-induced platelet aggregation, it is indicated for the prevention of stroke in patients with transient ischemic attacks, and D, it is a PROTA. So, right answer is it is a GP2B3A receptor antagonist. Fourth one, which of the following is the serious side effect of the Clopidogrel? Options are nausea, shortness of breath, nosebleed, headache. So right answer is shortness of breath. Fifth one, what drug class does Clopidogrel belong to? Options are antibiotic, anticonvulsant, antiemetic or antiplatelet. So right answer is antiplatelet. Thank you.